When does the bill go into effect?
November 1st.
November 1st.
November
Okay.
1st, yeah.
And so at that point, women should expect that if they're referred for one of these additional diagnostic screenings, contrast enhanced mammogram, and I think there's a few others in there, then they would be able to access those follow-up services without having to pay out of pocket then.
Right. And I mean, the high deductible is still
okay. There's still some exclusions.
But most women should be able to experience an expansion of access. And, when the bill passed, I took it to the breast center at St. Francis, which is right next to my surgeons. And I'm like, I told you this would happen, but, this is passed. And they're like, we're so pumped. We've been following it. And even within their own billing cycle and practices, they have been able to say, this is coming, but this is what is right now. So don't put this off, because we believe we can help you get it covered if we code it correctly to women. And so more women are getting tested. And so hopefully it'll help.
Yeah. And when you talk about increasing costs, it's so interesting because I think I agree with what you're saying. And I think Senator Stanley has the right approach, which is if you catch cancer earlier, we can do a better job treating it. Typically, we're going to be more successful treating it. And a lot of times there's less treatment required.
Right.
And it's the treatments ultimately that are really expensive. I mean, when you talk about stage 4 prostate cancer, and that doesn't surprise me to hear that her husband incurred millions of dollars in expenses. And so why not cover $600 or $800 or $1,200 for an exam to potentially prevent? That's a lot of exams you could pay for that would be offset by,
Mine was caught very early. It was 4 to 5 centimeters in diameter, very small. Yeah. And my surgery was $44,000.
Oh, wow.
And then the follow-up chemo was $7,000 of treatment. Yeah. And just to get my port removed was like $4,000. Yeah. And now I have a Herceptin shot that I get once every three weeks. Okay. It's a couple of $1,000s. Yeah. It adds up, and I just... that's early detection.
Yeah, right. And there are millions of people in the United States that are in medical debt, and not by any fault of their own. Right. Just the nature of the system.
Right. And we actually had a piece of legislation that we tried to get through this last session that said, medical debt cannot count against you on your credit report. Yeah. Because you can't really control it. Right. And even people who have socked away all the cash, it'll be gone in a second. Yeah. If you're spending it all on hospital bills.
Yeah.